Usually, and we'll get to my TikTok.
Yeah.
First, starting off, a couple of disclaimers. I do these at the beginning of all my presentations. This is just educational, informative. I guess. Close in the lights. I don't know. That's for on. Unfortunately, we can do on. I can do on. If people are okay with the lights off. So, yeah. There we go. Yeah.
It's great.
Yeah, no problem. Yeah, so the information in this presentation is for education, and informational purposes only. This is not medical advice. I will be talking about some medical stuff, but if you have any questions, definitely talk with your doctor. You should consult with your medical provider if you start any new exercise routine like hiking or going outdoors. And then if I mention any specific products, I do not have any financial relationships with them. I wish I did. I could probably get my mortgage easier. But it's just purely coincident to say specific reasons. So about me, again, my name is David Dickinson. I'm a physician assistant. I've been one for 18 years. And I have a very strong interest in wilderness medicine. Hence why I started these talks. I volunteer for a couple of local groups like the Pemmy Valley Search and Rescue and the Wilderness National Forest. And I just finished my fellowship in wilderness medicine. So today we're going to be talking all about ticks, which is very apropos because the ticks are out. Has anyone been bit by a tick so far this year? No, nobody, just me. All right. So yeah, I've been bit by one tick this year. And it is also Lyme Disease Awareness Month, which I found out during setting up this presentation. So very appropriate to be talking about ticks this time of year because this is when they typically come on for nation. So we're going to talk about some of the ticks that we see up here in New Hampshire, and I will be focusing mainly on New Hampshire. You know, ticks are worldwide, and we'll see a couple maps that go over that. Then we'll go over some tick facts, some of the illnesses, and then finally prevention, what we can do to protect ourselves against those little biting buggers. So, tick types. If you don't like big pictures of bugs, you're gonna hate this. All right. So this is the deer tick, Ixodes scapularis. Very common in this area. It carries a bunch of diseases that we'll talk about. But again, it's either called the deer tick or the black-legged tick. Next, we have the American dog tick. As you can see, a little bit different than our deer tick has this red shield with a black spot on the back. Our dog ticks are mainly brown, but they'll have this kind of whitish speckled dot on the back here that differentiates them from their very close look-alike, the brown dog tick. Again, mainly all brown, maybe a little black here, but again, this is mainly brown, whereas again, these guys are red. I actually do have some ticks with me. They're dead, don't worry. That you guys can look at later to see what a couple of these ticks look like. And then finally, we have the Lone Star tick. This is a relatively new citizen to our area in the past few years. It's kind of moved up from the mid-Atlantic states, and it carries a disease or disorder that we'll talk about. All right. So, you know, living in New England, we know a lot about ticks, but just let's go over some of them. So here is our tick anatomy. There will be a quiz at the end. So please memorize this chart. The main reason I wanted to put this up is a couple of things, especially when we're looking at removing ticks. It's all about this thing right here. This is called the hypostome. This is the lips of the tick. Ticks do not have a head. One of the falsehoods I hear, or a lot of people think, is like the tick has a head, like it buries its head. It actually doesn't. It sticks its lips in you, and that's what actually drinks your blood. And fun fact, all the ticks that suck blood are female. Males don't bite. Insert joke here. And then finally, we have our saliva glands right here, right behind the head. And this is where our diseases are held. All right. So when we're removing a tick, and we'll talk about how to do that properly at the end of the presentation, we really want to make sure that we get the body, the tick. If we leave this little part behind, as disgusting as it is, that's okay. I care about this part right because of this one. All right. So ticks typically have a either 2 or 3 year life cycle. The ticks around here are 2 year, so they'll hatch from eggs. They'll turn into these tiny little larvae that actually have 6 legs, and then they'll overwinter. They'll turn into a nymph after they feed, and then they'll feed again and turn into adult, and they'll lay eggs. Where we get into problems with the tick diseases that we see in this area is when it has its blood meal between larva and nymph and adult. Because the diseases that we get, like Lyme disease, don't inherently come from the egg. They actually are held in other hosts. Specifically around here, it's usually mice and deer. All right, so a tick will hatch, it'll find a little mouse, it'll suck on its blood, it'll fall off. And if that mouse has a disease in it, it now has it inside of itself. Then it sheds, and then the next year it feeds again. And somewhere in this cycle from here to here, humans can get involved. All right. So if you're bitten by a larva, you're usually pretty good. All right. But again, we're going to see a size comparison in a couple slides. So these are almost impossible to see sometimes. But getting bit by a nymph or adult, that's where we start transmitting Parkinson's. All right. So as we know, ticks are not around year round. We tend to not get any ticks in the winter time. And in order for a tick to be driven underground or into leaf litter or outright killed, you have to have multiple days of less than 10 degrees Fahrenheit or lower. With the changing climate, things tend to be getting a little bit warmer. Unfortunately, those days seem to be getting less and less. So we are seeing, I've been seeing in our clinic up in Lincoln, I've seen ticks on people typically from southern New England in December and January, whereas normally we don't have to worry about those. And then it seems to be right around this time, everybody starts getting bit by ticks. You go from 0 visits for me to like 4 or 5 a day. When the temperature gets consistently above 45 degrees, that's when the ticks start waking up and they start looking for a meal. As I mentioned, ticks can be very small. And again, I have some examples here. But look at this larva. Here's a dime. These things are about the size of a poppy seed. All right, so it's very rare that you'll find one of these. But nymphs and adult females, these are smaller adult females of these ticks, of the black-legged ticks, about the size of a sesame seed. Lone Star ticks, dog ticks, these can be a little bit smaller than a pumpkin seed. So pretty easy to miss, actually, depending where they are on your body if you get bit. Tick-borne illnesses are some of the most common vector-borne. So vector-borne is carried by another organism like mosquitoes or ticks. The most recent numbers I could find, 90,000 cases of Lyme disease. And then these are some other ones that we'll talk about, anaplasmosis, babesia. So very, very common to run into tick-borne illnesses here, especially in New England. This is the CDC map. I couldn't find a more recent map for 2020 than 2022. But as you can see, Lyme disease, this is all the teal colors, but it's buried underneath of all of these other tick-borne illnesses. As you can see, they've kind of made their way over Canada into the upper Midwest. And then we have some other ones that tend to be down in the central part, the mid-Atlantic states, and there's a little smattering down here in Florida. So you can see Lyme disease has made it all the way over here. And actually, Lyme disease has even made it out to the West Coast. There's a different tick out there that carries Lyme disease. Unfortunately, even if you go abroad, you're still going to run into tick stuff. You're still going to run into tick diseases. We're not going to talk about the worldwide stuff, but this map just kind of shows you ticks are very prolific, and ticks are everywhere, and ticks carry diseases everywhere. If at any point people have any questions, just feel free to shout them out, throw something at me, raise your hand. Doesn't matter. It's a small group. So tick illnesses. So I'm going to go over some of the tick illnesses. We'll go over symptoms. Obviously, it's going to be a lot, but I'm going to mainly show you the symptoms as a way to show you how much overlap there is and how non-specific the symptoms are. So Lyme disease, this is the one that we all know and read about the most. Borrelia burgdorferi, it's this little corkscrew bacteria that's carried by the black-legged tick. And last I checked with the state numbers, upwards of 60% of all the black-legged ticks in New Hampshire carry this bacteria. Typically, the tick has to be on you for at least 24 to 36 hours. And they say 1 to 4 weeks, it's usually 2 to 4 weeks, you'll start to get some symptoms. Anyone know just offhand, like some common symptoms you might hear of, like for Lyme disease, like ones that come to mind?
Like the bullseye rash.
Bullseye rash, yeah. Bullseye rash is kind of the big one. But Lyme disease can cause any of these symptoms. Things like joint pains, muscle pains, nerve pain, meningitis if it goes to the brain. Lyme disease can get very bad very quickly, but also can cause flu-like symptoms, especially in the springtime. Not only are we dealing with spring colds, but allergies. Sometimes Lyme disease can look like an allergic reaction. But yes.
Did you read anything about why is it specific to the black-legged ticks to carry Lyme disease as opposed to a dog tick?
I don't know the answer to that, unfortunately. Again, there's a couple other ticks that are not in this area that can carry Lyme disease. There's one over in Europe, and then there's the Ixodes pacificus, which is the western black-legged tick. But I can look into that and get back to you on that, Charlie.
Just curious.
Yep. So as Charlie said, the bullseye rash. This is kind of your classic bullseye rash. Tick bites usually in the middle here. But again, it's not always as clearly defined. So if you see something that's big, and people will come in with different bites and rashes and they'll ask me about, or is this the bullseye rash? Bullseye rashes are bigger, they're not these little tiny ditzels, and we'll go over a mimic in a couple slides. But I mean, usually like palm size, maybe a little bit bigger, and they start to grow from there. They can also be multiple. Doesn't just have to be one, doesn't have to be where they got bit. This was a patient of mine from last year who came in with, as you can see, all these little rashes on him. And he also had joint pains, no fever. It just felt cruddy, and he ended up having Lyme disease. I will say 20% of people with Lyme disease actually don't develop a rash. So bullseye is nice if it's there, not necessarily rules that out if it's not there. Now, this looks like it could be a bullseye, right? This is a pretty close-up shot. Here's another close-up shot. This is actually what we call a localized reaction. So these are a lot smaller, maybe a dime size or quarter size or smaller. They look kind of ugly. They get a little red. They might get a little itchy, a little scabbed, but they don't typically get any larger. This is actually my tick bite from about a week ago. And this was after about 4 or 5 days. Still itches a little bit. It's on my left hip. But as you can see, I get plenty of people who are concerned that this looks a little bullseye. And I would recommend, if you are concerned, you get a bite, you have something that looks like this and you don't know or are concerned, go get checked out. Happy to take a look at any bites. So another disease that we deal with up here is something called anaplasmosis. It's this little bacteria that goes into the white blood cells. Black-legged ticks, 12 to 48 hours, 1 to 2 weeks. Here are your symptoms: fatigue, muscle pains, fevers, chills, maybe a little bit more gastrointestinal stuff. We're starting to see some overlap with Lyme disease. Ehrlichiosis, black-legged ticks. They can be transmitted even sooner. 1 to 2 weeks of symptoms: fevers, chills, headache, fatigue, muscle pains. So again, these are not to memorize. It's more of a, let's recognize that tick diseases can look a lot like each other and can be very non-specific and can mimic a lot of other things. Again, nausea, vomiting, diarrhea, a norovirus could do that. And then there's babesiosis. Black-legged ticks, 24 to 48 hours, 1 to 4 weeks afterwards. This is actually a little parasite. It's kind of like malaria. Invades the white blood cells. And again, fevers, chills, headache, muscle pains. So what I always tell people is if you're bit by a tick, monitor your symptoms. 1 to 4 weeks, look for any of these things to start popping up. And if you feel off, go see somebody. They'll help, we're happy to see you and help you out and draw some blood and see if you got a tick-borne illness. Now, the last one I'm going to talk about is one that's kind of up and coming in this area, alpha-gal. So there's this sugar, here's its full name. It's transmitted by the Lone Star tick. That tick is that brown one with the white spot in the middle. Again, looks like the Lone Star flag. We don't know how long it takes to transmit it. And what happens is after the tick bites you, you get antibodies to this sugar. And where do we find the sugar? In meat. This is a red meat allergy that is caused by a tick. Usually it's mammal meats, except for primates like humans, so you can continue to cannibalize one another if you get alpha-gal.
Yeah.
But this can range anywhere from hives all the way up to full-blown, you need an EpiPen anaphylactic reaction. And some people are so sensitive that they can't even take gelatin or dairy products. So, there are some capsules, for medications that have gelatin in them. So they can't take those. So this is one that's unfortunately kind of coming. It's already a little bit here. So you can see right now, it's usually in the central or mid-Atlantic states, but we are starting to see a few cases up here. Massachusetts and Maine definitely have Lone Star ticks. It's not out of the realm of possibility that they're here. I've not found one yet, but all the more reason to make sure that we are judicious in taking ticks off and protecting ourselves.
Is it treatable?
Not with anything specific. They think eventually if you actually abstain from eating red meat for a period of 6 to 8 years, that the antibodies may wane. But to this day, there's no specific treatment for it. It's just avoidance of triggers. Yeah. And again, we don't know how long it takes. It might be an immediate injection. It might be 12 hours, 48. They're still looking into it. All right. Now we've learned about the scary things that ticks can give us. We've learned about the ticks. Let's talk about how we're going to keep ourselves from getting bit. So the first thing that we can do is a physical barrier. Long pants is preferred, obviously, because if they're on a blade of grass and you walk by them, they're on the outside of your pants and you have a better chance of finding them. Lighter colors are better because of that. Again, ticks are typically darker, so they're easier to see. Also, I don't know if anyone ever learned this about tucking your pants into your socks, but again, that keeps them on the outside. Hopefully makes it a little bit easier for you to see them as they crawl up, because they can get on your shoes and actually crawl up underneath your pant leg. I've also seen some people wrap duct tape, inside out on the bottom of their pant leg. I'm sure it works, but I wouldn't rely on it. So then we get into the repellents. So the first one I want to talk about is something called permethrin. Permethrin is an insecticide. It's actually used in wasp spray and foggers and things like that. And they do sell it to treat clothing. It's actually can be very toxic if you put this on your skin for extended periods of time. But these sprays, this is Sawyer, but Off makes a brand. When you put it on your clothes or your gear, and we do recommend things like your boots, tents, backpacks, shorts, socks. Actually, my pants, I treated these a couple weeks ago. You have to let it dry, and then toxicity goes down after that. It doesn't get absorbed easily into your skin. But the problem is you do need to reapply it regularly. depending on the spray can be every 2 weeks. Specifically, the brand I use said every 8 washes. Obviously, if you're sweating, if it's raining, you may need to reapply more frequently. But this is kind of the first thing I recommend for people is a permethrin spray. Then we have our personal sprays. So good old fashioned DEET. DEET's been around since the 40s. Our troops over in the Pacific were getting bitten all to heck, and the Army said we need to find something to protect our troops, so they came up with DEET. You can find DEET anywhere from like 5% up to good old Ben's 100, 100% DEET. According to the American Academy of Pediatrics and FDA, DEET is safe for all ages. I don't know if I put 100% DEET on a kid because it can cause, the higher the concentration, you can get rashes. DEET can actually dissolve certain plastics. Actually, I have some pitting on my watch face here from DEET getting on it and chewing into it. Glasses can get it too. But things like nylon, like cheaper camping tents are made out of nylon, and this can weaken it and actually chew holes in it. It also, when you put it together with sunscreen, actually reduces the effectiveness of the sunscreen as well. And also in very high doses, like regular high reapplications or ingestion, specifically children can get like seizures and stuff. It's not a bad, I know there's a lot of cons, but it's not a bad repellent if you use it correctly. It's also the easiest to find. DEET is practically everywhere. I actually went to 3 different Dollar Generals looking for this stuff, but I found this stuff in spades. All right. And then we have a newer one, newer being from the 80s. This is a derivative from the pepper tree, picaridin. So again, Off makes a brand. It comes in the purple can. Nice thing about picaridin, doesn't have a greasy afterfeel, which DEET can have. It doesn't really smell too bad. And it doesn't dissolve plastics or synthetic fibers, and it is non-toxic as far as we know. It can be used from birth to death. So this is a pretty good alternative, and I've actually started using this over DEET, just because I'm finding the odor of DEET to be a bit much for me sometimes, and to save my glasses and my watch. A couple other ones that the FDA has approved for tick and mosquito repellents. Anyone use Skin So Soft? This is a smell of my childhood. It's a very unique, this is a very unique smell. IR 3535 is like the chemical name for it. But Skin So Soft, it does help. It used to be the only thing they really recommended for kids under 2, until they revised the recommendations. Now DEET can be used. It's okay. It uses it basically like just has a very strong smell and kind of fries the tick's sensing organs. Again, it's not as, when it's put up against DEET and picaridin, it's not as good. Same thing with, there's an essential oil that actually works, people. Oil of eucalyptus, lemon oil of eucalyptus. If you're worried about the toxicities, again, this has a little bit of evidence. It's not very strong, but it has been shown to work in some situations. And again, is safe for kids of all ages. And I put something like this on our dog, but again, they have pretty strong noses, so you might want to be a little hesitant on putting too much of this on. And then we have all of these. Anyone heard of like the eating garlic trick for mosquitoes and ticks?
You have to eat it for quite a while.
Yeah, you have to people say you got to eat more, you got to reek of garlic. Unfortunately, doesn't work. Citronella
Worse than vampires.
works for vampires, yeah. And other people too. Citronella doesn't work. This is other essential oil stuff. We actually used to sell this at our clinic. It's got rosemary oil and lemongrass and thyme and cedar oil. That stuff doesn't work. These little mosquito bracelets, if you put them around your ankles, these don't work. And then they have these hyper ultrasonic things. They don't work either. So unfortunately, don't use any of this stuff.
Citronella doesn't work
Citronella doesn't work for ticks or really for ticks at least.
for ticks.
Yeah, for ticks. Yeah, it might work for mosquitoes, but not as well as mosquitoes is a whole different talk, but not as well as DEET and picaridin. Citronella is like it's pretty weak evidence, but it smells nice. All right, tick checks. So as New Englanders, usually it's ingrained in us to check ourselves for ticks. These are all the places to look: behind the ears, hairline, anywhere that's dark, warm, and moist. Because this is a child, I believe they kept out the groin, but definitely in the groin is a place. But I have found ticks on people in a lot of different places. I haven't seen it, but I've heard eyelids, lips, mouths, and nether regions. Also, there's a thought that if you come in within 2 hours and bathe, not only does that get you naked so you can see more of your body, but there's a chance that you can wash up any ticks that haven't attached yet. Because ticks aren't like mosquitoes where they find a place and immediately go. They're going to look for the right place. That's why you can pick them up on your shoe and find them in your hairline. They're not parachuting down from the sky to bite you. So tick removal, just to go over the tick removal. Again, we're going to try to remove that tick as soon as we find it, because the sooner we get it off, the less chance there is that a disease is going to be transmitted into us. We're going to take our tweezers. We're going to grab right next to the skin. And we're not going to twist. We're not going to yank. We're going to pull straight up in a nice fluid motion. All right. And then because this is a break in the skin, you do want to wash this immediately. Maybe a little antibiotic ointment over. Bless you. All right. And this picture is great. Again, we want to get all of this part out. Now, in my experience, deer ticks, some more often than not, will actually leave their mouth part in you. All ticks have backwards hooks on their mouth parts, so they don't come out as easily, similar to a fish hook. Deer ticks, for whatever reason, however their anatomy is, more times than not, stays behind. Things like dog ticks and deer ticks, when you pull them off, they'll actually take the first couple of thin layers of your skin off. It doesn't hurt, but you'll see their little head, and it almost looks like a lion's mane. It's this little ring of tissue. So that's how you know that they got taken off successfully. So I've heard of many different ways of getting ticks off. Burning them off is my favorite because they tend to hurt themselves. People tend to hurt themselves. Don't put gasoline. Don't put fingernail polish. The problem with these, especially Vaseline, rubbing alcohol, like if you irritate the tick before it dies, there's a chance it actually can inject more into you, like regurgitate, actually put more stuff into you and actually increase your risk of developing the disease that it might be carrying. So pull straight up and out. Now they do make some cool little tools. My wife and I have these little things. Basically what they are is I know it says to twist, don't twist. You kind of bring them into this little notch and you just pull up. These tick spoons are pretty easy to find as well. Same thought process. There's this little tiny notch in there. You kind of put it in there and you pull up. These are actually made in my hometown of Dover. I actually know this guy right here. His name's Eric. He was in my Boy Scout troop. But yeah, these work great. You can usually find these in Walmart and stuff. I have these on my keychain in my truck, which I should have brought in.
I have mine.
Oh, you good?
Yeah.
All right.
It's this.
Yeah. Yep. All right. So antibiotics, obviously this isn't something that everybody's going to be doing on their own, but just so you know what could happen to you if you go to a doctor or a clinic to be checked. There is a preventative treatment for Lyme disease. As long as you are bitten by black-legged tick, it's engorged. So engorgement means that it's starting to fill up with blood. So instead of flat, it's actually starting to fill up almost like a little pea, and they can actually get quite big, especially like the dog ticks. For those of you who have dogs and have ever pulled a tick off of a dog, sometimes if they're hidden, those guys are like the size of a raisin. They're huge. But it has to be on for at least 24 hours and be from an area that has no Lyme disease, which we do. I'm a bit more liberal with giving out this single dose of medicine just because I don't want people to get Lyme disease. And it has been shown to reduce Lyme rates up to 70%. So if you go in to, oh, I see you shaking your head.
But
Hmm?
I'm surprised that you're still talking about that because there's a well-known study that 200 milligrams was just to reduce the rash and not the disease.
So as far as I know, and as far as the Infectious Disease Society of America has said, they're still recommending this.
Yeah,
All right.
it's
I'd be interested to read that study if you
absolutely, yeah.
send it to me. Yeah,
Yep,
absolutely. I would love to read that.
Yeah.
Yeah. But anyways, this is probably what's going to happen if you have that. And then the vaccine. So we don't have a vaccine right now. We used to have one back in the 90s, late 90s. There was one called LymeRix. It was 3 doses, reduced your chance about 76%. It didn't sell very well. It was around the time that there was vaccine hesitancy. There was the talks about vaccines causing autism. So it kind of came off the market. But now there's a new one. Phase 3 trials is when you get a larger group of people together and you start giving them a investigative drug. They had them, I think the closest center was in Burlington. They were doing it. It's 4 shots, again, about 70% reduction. This is going to take a few years to come out. I don't even know what they're going to call it. But just know that that is in the pipeline, that they're looking for a Lyme disease vaccine. Unfortunately, there is no other vaccines for any of the other tick-borne illnesses as of this moment. And then we can't forget our favorite little pooches. I always check my dog after every walk or hike. Maybe essential oil tick repellent. Again, dogs' senses of smell are a lot stronger than ours, so keep that in mind, especially if it's very strong smelling for you. Be sure to be up on their flea and tick medication. That is very important. And dogs have a Lyme disease vaccine. And then if you do see any new symptoms such as lameness or troubles breathing, poor appetite, get them to their vet.
I was talking to my neighbor who has a dog and they said they were waiting on a delivery from, I think, Chewy they said permethrin to put on the dog. Is that acceptable for a dog?
As far as I know, I'm trying to think what is in, because there's chews and then there's the topical stuff. I cannot remember what's in those things, but yeah, I mean, if Chewy's sending it, presumably it's okay to put on them.
Permethrin.
Yeah. I again, like I'm not a vet, so I would have them talk to their vet about that. Depending on what, like I said, I cannot remember what is in.
Yeah, that's what surprised me when they said, "Oh, we're getting permethrin." I'm going like, that's just applied to clothing.
Yeah. Yep. Is it like a medication they were giving, or was it like a?
It sounded like a medication we're getting.
Because they make the flea and tick collars, and those presumably would have. I would suspect those have permethrin in them.
Possibly that.
Yeah. Yep. All right. And that's the end of the tick talk. Does anyone have any questions? Yes, ma'am.
Those other 2 illnesses that you mentioned,
Yeah.
if they're left untreated, do they just continually get worse, or can you wait it out? Like,
Depending on how it's affected. So these diseases have been around for a lot longer than modern medicine. So there are people like Lyme disease. You can actually beat it. It's not great because you can be left with lingering symptoms if not treated correctly. But there are some people who actually beat Lyme disease and have antibodies for it afterwards. The other ones, yeah, if left untreated, it can lead to like anaplasmosis can lead to like anemia, low blood counts, low platelets, low troubles clotting. So, and people can't get chronic symptoms from it. So it's best to treat those as soon as possible. I wouldn't wait it out or be seen to be evaluated.
Mhm.
That's right.
You may have answered my question, but is it possible to get a bullseye rash and not have Lyme disease?
No, it's pretty typical for Lyme disease. Again, 20% of people don't get the rash, but if you have, it's so strongly associated that actually the recommendations are if you see a characteristic bullseye rash, you don't even have to test them for Lyme disease, you just treat them. They still recommend testing for other ticks because one thing I didn't mention is a tick can carry multiple diseases. It is not a one carries Lyme, one carries this. You can get multiple diseases. So it's still recommended you get tested for the other diseases. But no, if you have like the characteristic bullseye rash, it's pretty much Lyme disease. There's not anything else that I can think of that I would.
You know, it's bad enough we get the black leg and the dog ticks but I've read articles that Lone Star tick is really bad news.
That's the one that worries me the most. Just in terms of like allergy, because there's no actual treatment. Lyme disease you can treat, all those other ones you can treat with the appropriate antibiotics. For the majority of them, it's doxycycline. But yeah, that allergy, no, they're investigating treatments like allergy shots. Some people go on antihistamines, but it's really you have to avoid eating red meat or mammal meat. So yeah. So imagine if that gets down to Texas.
That's what they were saying.
That's going to wreak havoc.
This one other is Powassan virus.
Powassan virus. Yeah, I didn't go into that just because it's a little bit rare. There's a few other diseases. So Powassan virus has a lot of similar symptoms. People can get very sick from it. There's other diseases like Rocky Mountain spotted fever and tularemia, which aren't really up here. They have a whole different set of symptoms. Rocky Mountain spotted fever literally gives you a spotted rash. In New England, it's pretty much relegated to like Western Connecticut. That is actually carried by the dog tick. But again, diseases don't follow borders. So presumably at some point we can start getting those diseases up here, especially with the amount of traveler, people come to our region to go on vacation. So presumably that's going to be a problem at some point. But yeah, the alpha gal syndrome is the Lone Star tick is the one that I'm the most worried about.
There's a guy I watch on YouTube called the Stony Ridge Farmer, and he's a cattle farmer down in, I think, North Carolina, and he has that.
Yeah.
He can't eat meat anymore. It's a shame he raises beef.
Yeah, I've met a couple of people who I didn't diagnose, but they came in and they were from the Mid-Atlantic. Like one guy was from Virginia, I think another was from North Carolina or Kentucky or something like that. And yeah, he's like he has to change. You have to change your entire diet and monitor for like if gelatin's used in a bunch of different foods and products, and then obviously dairy, milk is in a lot of stuff as well. So you really have to be very, very choosy and very, very careful about what you ingest.
Now, can you test for Lyme at the urgent care, or does that have to go to the lab?
No, it's gotta go to the lab. Yeah, we used to have a rapid test. It was horribly inaccurate. We send them out. There's specific tests for each one of these. But yeah, we have to send it out. It usually takes a few days to come back.
I enjoy taking the labs up there.
Yeah.
Once you get the chance.
We appreciate you taking the labs up there.
Well, we make a day of it, go out to breakfast, run our errands,
Yep.
and get paid.
I was wondering, what can be done to control the tick population? Like there are natural predators like possums and
Yeah, so
birds. But
yeah, so that's one thing I didn't really talk about is like what are some of the things you can do. So obviously there's like the chemical means of like foggers and different like permethrin sprays and things like that. The things that eat ticks, yes, possums eat ticks. Famously they eat like millions of ticks a year. Also people like chickens and guinea hens can do that. Controlling the mice population around your house is actually really important because again, mice are one of the reservoirs for tick diseases. So making it inhospitable for them. I did read a few years ago about, or maybe it was a YouTube video about somebody who took like a week permethrin, soaked cotton balls in it, and put it in toilet paper tubes and put it around the perimeter of his property. And the theory was that the mice take the cotton, bring it to their nests. And it's not toxic for the mice, but it's just enough to kill the ticks that are on them. I have not done that yet, but that's one way to try to control the population. Unfortunately, the deer aren't. You're going to be hard pressed to keep deer out of the woods.
Are you familiar with the Carey Institute with Ecosystem Studies in the North?
I'm not.
They have a tick ecologist they've been studying for 30 years, the different methods of controlling ticks, and they did a 5-year study, and they put out what you just described, and plus they use minerrhizum, which is a natural mycorrhizal fungus. And they did some other things, and they found that there was absolutely no effect on the transmission of disease.
Yeah.
It killed ticks, but there was no effect on the transmission of disease because you don't live in bubbles.
Right.
So,
Yeah.
so you have that fluid movement of animals and ticks, and dropping deer coming in, dropping ticks. And
Yeah.
so forth.
Yeah. So as I said, like they don't pay attention to borders or anything. So like I said, it was just one thing, I hadn't tested it or anything, it wasn't a scientific study, but that was just the thought process behind it. But that's a really good point that, that's just the animals around you, but mice and deer, and I mean, it's not just mice and deer, any mammal can carry these things. So presumably, your possums and raccoons and skunks and stuff can carry them. Moose, the tick populations are really decimating the moose populations. They can get thousands upon thousands of ticks and actually be sucked to dry. And again, that's coming from the kind of the warming climate. Ticks are sticking around longer and taking them down. All right. Well, thank you everybody for coming.
If you do.